Hi, this channel. So today I came with another one informative video regarding OET letter. So as you know that there are many changes it's happened in OET letter writing in 2021, maybe from April. So some of you are unaware about the updates. So until 2023 last month we have the same updates. There are no more updates since then. So I will just have a quick review of these all updates from date until viewers insert. Okay, so we'll start from the date. So the date before we used to keep comma, slash, hyphen, everything. But now we have only one thing. It is like example, I will tell you 1 January 2024. Like January J should be caps lock. And when you will go to the address, um, maximum try to avoid commas in between, but if you have numbers there like example 3 then main road something like that, you can keep comma, but maximum try to avoid comma after the complete address. I mean, even in one line when you finish the address, don't keep any commas. When you will come to dear, like dear Dr. Joseph, if you want to keep comma, you can keep it, but don't forget to keep comma when you write yours sincerely or yours faithfully. If example, if doctor's name is there, example like Dr. John, Dr. Mr. John, comma, then when you write yours sincerely, don't forget to keep comma. Then when you will come to dear, after dear, regarding you'll just write a patient's complete name, either age or date of birth. If they have given both age and date of birth, preferably you can write age because it is easy for the reader to understand how old he or she is. That's your choice. Then if you want to write age, keep comma after complete name, aged 80. Actually no need to keep years, but if you have a baby, is your patient is baby, you can keep that weeks and days and all after the digit. Then if you want to write date of birth, don't write straight in the straight line of name. You can no need to leave one line underneath regarding. You can write date of birth, caps lock DOB, then colon, then you can write in the same format, example like 8 January 1973 or something like that. Then leave a line, then you will come to introduction. There are a lot of changes happen in introduction. There are different types of introductions are there. It's very easy to write. All Indians used to write in the same format, like I am writing to refer. That is easy one. But there are many formats you can write. The purpose of this letter is to introduce, or I am introducing Mr. So and so on. Or for non-case, there is only one introduction. I am writing to update you the current health status of. You can exclude that current, it's okay, fine, because you are updating means that's the current status only. The other thing, we have behalf letter. That means your example, if example they have given wife's name like Elizabeth and the patient name is Mr. John, you can write like I'm writing on behalf of Mrs. Elizabeth for her husband, Mr. John Matthew, who has, then you can write. So this is the typical example of behalf letter. Then when you will write in the introduction, mainly there are three things. Okay, so the last one is optional. Mainly there should be two. You will introduce with a complete name. You will introduce the patient with a complete name and the condition, the medical condition. Everybody used to make mistake. Keep concentrate only on current status, current medical status. If he or she has, what is the exact status? Example, if patient had MI, but he or she has undergone bypass surgery, no need to mention MI in introduction. You can write he or she has undergone the surgery. You can mention the surgery name, but in a present medical paragraph, you have to explain regarding MI, when he got admitted and with what are symptoms and what is the diagnosis, then what you did. So that is the difference between introduction and present medical paragraph. The current status have to be written in like in introduction. Then the next one is requirement. As you know that some used to write complete recommendation in the introduction. Even if it is one sentence, don't go to write the recommendation sentence in introduction. It is a requirement. Requirement and recommendations are different. Requirement, it is a sum up of recommendation. Recommendation is its expand form of requirement. Okay, so don't mix with each other. Example, you can write like continued care, ongoing care, follow-up care, respite care, assistance and management, supervision and supportive care, something like that you can mention. But don't forget to avoid the term care for doctors. Okay, see how to write like further assessment and management or further attention or whatever you can mention like that way. So this is for the doctors, don't forget it. A discharge plan, it is optional. Either you can write he's being discharged today or he's set to be discharged tomorrow or whatever, but don't forget for non-case letters we will write he is being discharged back on today or tomorrow or whatever, discharged back. Okay, so that's the term, you have to use it. That's all about introduction. When you will come to the present medical paragraph, many things happen because nowadays the questions are very tricky, but it is much easier than the previous question papers. If you go through my YouTube channel, the playlist, there are recent exam questions. There are many questions, 50 plus questions we can see, and you can practice with that. Sample letters are also there. Here you can see it is a typical type of questions. Like the particular thing is you have to divide the present medical paragraph into two. I'm strongly suggesting you everyone to make two paragraphs. The present medical paragraph should be two paragraphs, not more than two. Okay, if you concise and write it in one paragraph, it will be much bigger and the presentation will not be good enough. So can be two, but your talent is here how you will segregate the data into two paragraphs. I will give you example and it will be easy for you to organize your letter, especially your present medical paragraph. And don't forget that this is the paragraph will bring you the most B score. Okay. Example, if you have like mostly in every question paper you will have two scenarios, like one hospitalization, remaining things like home visit. So what are the things that's happening in home visit? Or else you will have only the hospitalization, but you can divide the presentation when he or she got admitted in the hospital, clinical features, diagnostic evaluations in one paragraph, and you can write all management in the next paragraph with the summary. Okay, and if you have like one hospitalization and home visit, all hospitalization can be in one paragraph, and what are things that happen in home visit, you can write it in the second paragraph. Another one more thing, only one thing. There is only one scenarios or the settings. It is in the home visit or it is in the nursing home. Example, in those scenarios, you can write all relevant data in one paragraph. And what is the thing it's happened today? You can write it in the next paragraph. Okay. So these are the techniques you can use how to make some more presentation or how you can modify your letter in a pleasant manner. Okay. And then one more thing, sometimes there will be tricky questions. Something happened today, but they have given like very old history. So what you have to do, see whether is it emergency letter or urgent letter to emergency department. If it is like that, start your sentence with it today. What are things is happened today? Make it the first paragraph. Then you can go to the next paragraph, starting with recently. Then you can write all the previous incidents, what are things it's happened over there. Okay. So this is the common way how you can organize your letter. If you go through my letters, I hope it is easy for you to understand. I didn't make the letters very complex. So just you can go through in that way. It looked like simple, but it is enough for you to get B score. No need. So I mean, some question papers have a very good presentation that everything will be in an order. So they, you will not get any confusion how to write the sentences. But most of the letters, in most of the letters, you could not see any order. It can be like without order, like recent questions, recent things will be, incidents will be first and the previous one will be in the last. So it will be like a mixed up and you will get a lot of confusion while writing the letter. So don't depend completely upon the question paper. Once if you read the question paper, segregate yourself and have a good idea that what are things that's happened first, gradually what are things that's happened and what is the current status. Okay, so that is the important thing. Just end up your present medical paragraph with the current status, then add one more sentence. Therefore, further attention from your service is essential for his or her well-being. So just a simple sentence you can add at the end of the present medical paragraphs. It will make a lot of differences in your marks. Then when you will come to the social paragraph, many students have still confusion whether present medical paragraph, after present medical paragraph, where you will write personal history, then again whether you will make another one paragraph for social paragraph or like a past medical or surgical history. So what is the exact thing, typical thing means after present medical paragraph, we have only two more paragraphs. One is known as social paragraph and then last one is recommendation paragraph. This social paragraph comprises of your social, that means the personal history as well as past medical and surgical history. Don't split it into two. It is single paragraph, but personal can write in the starting and the past medical and surgical, all medications, the current medications, everything you can write it over the after the personal history. That's only the thing. It makes differences between the past medical and the social, but it's not a single paragraph. Okay, it's comprises of single paragraph. Then when you will go to the recommendation paragraph, this is the expansion of your requirement. Like continued care means whatever the continued care you have to give, that one you have to write it here elaborately. Sometimes there will be a tricky question. There will be they used to give in past tense what all things is happened during hospitalization, but they mean that this have to be continued. So if you want to write it in present medical paragraph, you can write it in past tense. Like example, you can tell during hospitalization he was or he has been commenced on or he was commenced on, so and so on. That's already finished. But if you want to write it in recommendation paragraph, it should be like a recommendation, not in the past tense. That means kindly administer so and so on medications. Okay, so it will be in the past tense. So please see the grammar and don't make mistake in tenses, especially the tenses, because recommendation is going to be happen in the future. But like present medical paragraph comprises of what all things it's happened already and what is the thing is going on now. So there are different sentence constructions in these two paragraphs. So at the end you can just write it would be appreciated if you could, then you can write all the recommendation. Then at the last you can write please do not hesitate to contact me if you have any queries. Then yours sincerely and faithfully, these two. If the reader's name is given, you can write faithfully, sincerely, and if the reader's name is not there, you can use faithfully. Then at the end you can write registered nurse. Don't use only nurse, it should be registered nurse. Or specifically if they have given like psychiatric nurse or tissue viability nurse, community health nurse, school health nurse or something, it's like they have given the designation clearly, means you can write the same thing, and no need to keep no need to keep full stop after the registered nurse or the designation. So these are all the things you have to keep it in mind, and these are all the things it's happened in updates. Everything how to be kept in mind when you are writing the or a letter. And don't jump to the question paper or jump to the letter writing. Just read it and make an overall idea, then you can start writing. But don't waste time by thinking. Just you can have an idea, then start writing the date at least to the address until you can write regarding and regarding the date of birth, and you can just start the introduction. Okay, then it's already started, so that it will not make you stop somewhere, because if you didn't start, the time will go and you will stuck somewhere, you lose the confidence, and at last you will not get the time. So just start the letter and until introduction, then you can think what is the thing you have to write in the introduction, then how you have to organize the present medical paragraph. And I don't know how many students knows that in that answer sheet, in the last page, there is a empty page. You can scribble something there if you want to organize. While you're organizing the letter, you can just write over there, and no need to rub it, because it will not calculate it for evaluation. And in you can see the heading that it is for like practice purpose, so you can just use that last page. Okay, the last page, that's empty, that is not it's not a ruled one, there's no lines and all, so you can write over there in a simple manner, but don't waste time by writing over there. So these are things you have to keep it in your mind while you're preparing for your exam. Try write in the same way, and if you have any doubts, you can just message me in the given WhatsApp number, or if you have any doubts, you can even comment in this video. There are Telegram groups, there are WhatsApp groups, and if you want to get more information, you can message there as well. And if you want to join in my academy, I have a small online academy for OET for all modules. You can join over there, and if you need guides for writing, speaking, listening, and reading, so you can message as well. So I'm here to help you. We'll see you with another one informative video. Until then, bye.